Hi guys, Jackie here. So today I wanted to jump on and talk to you guys about mouth breathing. So as a myofunctional therapist, one of my goals is to make sure that you are nasal breathing by the end of therapy. And so that means your mouth is closed and your lips are sealed. So why do we mouth breathe? One of the reasons we mouth breathe is because there's some sort of physical barrier, and that could be a deviated septum, that could be enlarged tonsils and adenoids, maybe some inflamed nasal polyps, something that is physically blocking the air from getting through your nose. And so you use your mouth as a crutch to make sure you get that oxygen. And so another reason we mouth breathe is because maybe you're suffering from some chronic congestion, maybe you have some severe allergies. Those allergies sometimes are pet dander, dust, dairy. Sometimes you don't even know you have allergies to those things, but those are the big three that are causing nasal congestion, you guys. Just because you're not going to the hospital in hives, just because you're not getting sick, doesn't mean that you don't have an allergy to something, okay? And so the nasal congestion is a side effect of an allergy. So make sure you keep that in mind. If you are having trouble nasal breathing because you're so congested, look at your diet, look at your pets, look and see what could be contributing to that congestion. And so the third reason is because it's a habit. So maybe you had enlarged tonsils and adenoids, maybe you had surgery, you had them out, maybe you were suffering from these allergies. Well, so now you've taken care of the root cause, but you haven't trained yourself to nasal breathe. And so that is what we do in myofunctional therapy is we retrain those muscles, we retrain your lips to stay closed, we retrain your cheeks to do what they're supposed to do, and we retrain you to breathe through your nose. And so that is super important. So some of the things that people suffer from when they mouth breathe are they have some sleep disorders, they have some acid reflux, they have crooked teeth. Our tongue is supposed to rest in the roof of our mouth. So when it's resting in the floor of our mouth, it causes our palate to collapse. It causes our teeth to become more crooked and crowded. It causes us to swallow incorrectly, which is where some of the acid reflux is coming from. And so it's super important that we get these things corrected. So another thing is that it's causing some sleep disorders. If you are sleeping with your mouth open, it's going to lead to snoring, which is then going to eventually lead to sleep disordered breathing and sleep apnea. You guys, these things are extremely bad for your health. They can lead to anxiety, depression, ADHD. We're seeing a lot more children suffering from mental health issues, and it's all stemming from their sleep. And so we really need to take a look at the kind of sleep they're getting, the quality of sleep they're getting, the quality of oxygen they're getting. If they're breathing through their mouth all night, that is not quality sleep or oxygen. You guys, we have to get these kids and adults to breathing through their noses, okay? And sometimes we need to look for a physical reason. Sometimes it's a habit. Sometimes it's the congestion. You guys, we have to find the root cause and we have to fix it and retrain it. And so I just wanted to jump on here and let you guys know that those are some of the things that I see. And if you guys have any questions, please feel free to jump on and email me or ask the questions right here on Facebook. Thanks.